Imagine a silent assassin lurking deep within your body, growing undetected for months or even years. That's the reality we face with pancreatic cancer, one of the most challenging cancers to detect and treat. I'm Dr. James from Pancreatic Cancer Warriors, and today we're diving into the frustrating reasons why this disease often evades our best efforts at early detection. Let's start with the core anatomical challenge. Picture your pancreas as a small, delicate organ nestled deep in your abdomen, hidden behind your stomach and tucked in front of your spine. It's like a shy creature, avoiding the spotlight and staying out of reach. This location makes it virtually impossible for doctors to feel during a routine physical exam. Unlike a lump in the breast or an unusual mole on your skin, a pancreatic tumor can grow silently, shielded from our touch and sight. But it's not just the pancreas's hidden nature that makes detection so difficult. In its early stages, a small pancreatic tumor is like a stealthy intruder, causing no alarm bells to ring in your body. There's no pain, no obvious warning signs, nothing to make you or your doctor suspect something's amiss. It's as if the cancer is whispering instead of shouting, making it easy to miss those crucial early stages when treatment could be most effective. When symptoms do finally appear, they're frustratingly vague and all too easy to dismiss. Indigestion, a bit of back pain, feeling slightly nauseous, or losing a few pounds without trying. These could be signs of pancreatic cancer, but they're also symptoms of countless other, far less serious conditions. It's like trying to spot a specific raindrop in a thunderstorm. Most people, and even many doctors, will naturally attribute these symptoms to stress, gastritis, or irritable bowel syndrome first. After all, those are much more common culprits. Now, let's contrast this with other types of cancer. For breast cancer, we have mammograms. For colon cancer, there are colonoscopies. But for pancreatic cancer, there's no simple, widely recommended screening test for the general population. No annual blood draw or quick scan that can catch this disease in its infancy. Screening is typically only offered to those at high risk, leaving the majority of us vulnerable to its silent progression. As if these challenges weren't enough, the biology of pancreatic cancer itself seems designed to evade detection. Some forms of this disease are incredibly aggressive, with the ability to spread to other parts of the body even before causing any noticeable symptoms locally. It's like a wildfire that's already jumped to neighboring forests before UVA spotted smoke in your own backyard. This biological trait makes finding pancreatic cancer at a truly early stage even more of a Herculean task. All of these factors combine to create a perfect storm of delayed diagnosis. Picture this scenario. A patient experiences some vague discomfort, maybe some unexplained weight loss. They visit their primary care doctor, who, quite reasonably, starts investigating more common and less serious causes. Weeks or months might pass as various tests are run and treatments for other conditions are tried. By the time the symptoms persist or worsen enough to warrant more invasive testing, the cancer may have already advanced significantly. It's a frustrating reality, one that can leave patients, families, and even medical professionals feeling helpless and angry. But here's the thing. Understanding these challenges is the first step in overcoming them. We can't change the anatomy of the pancreas or instantly develop a perfect screening test, but we can arm ourselves with knowledge and vigilance. So what can we do in the face of such a stealthy adversary? Awareness becomes our most powerful weapon. While we may not have a simple test, we do know that certain combinations of symptoms should raise red flags. New-onset diabetes in someone without obvious risk factors, especially when combined with unexplained weight loss, jaundice, yellowing of the skin or eyes, or persistent abdominal pain. These are constellations of symptoms that demand swift and thorough investigation. It's also crucial that we listen to our bodies and advocate for ourselves in the medical system. You know your body better than anyone else. If something feels off, if symptoms persist or worsen, don't be afraid to push for more answers. Sometimes, being that patient, the one who asks for a second opinion or additional testing, can make all the difference. For the medical community, this challenge underscores the need for continued research and innovation. We need better biomarkers, more sensitive imaging techniques, and perhaps even entirely new approaches to early detection. Every advance, no matter how small, brings us closer to unmasking this silent killer. To those who have been touched by pancreatic cancer, whether as a patient, a loved one, or a healthcare provider, I want to acknowledge the unique frustration and pain this disease can cause. The road to diagnosis is often long and winding, filled with false starts and dead ends. But please know that your experiences, your stories, are invaluable in raising awareness and driving progress. As we conclude, I want to leave you with a message of determination, not despair. Yes, pancreatic cancer is hard to detect. Yes, the challenges are significant. But that's precisely why we need to be smarter, more vigilant, and more united in our efforts to combat it. Every person who learns about these detection challenges, every doctor who keeps pancreatic cancer on their radar even when faced with vague symptoms, and every researcher working tirelessly in the lab, we're all part of the solution. Remember, understanding the enemy is half the battle. By knowing why pancreatic cancer is so hard to detect, we're better equipped to spot it, to fight it, and ultimately, to beat it. Stay informed, stay vigilant, and never underestimate the power of awareness in the face of this formidable foe. This is Dr. James from Pancreatic Cancer Warriors, reminding you that knowledge is power, especially when it comes to your health. Together, we can shine a light on this hidden disease and work towards a future where pancreatic cancer can no longer hide in the shadows.